Hello, thank you for this conference. It's really interesting that we can hear in many languages art therapy projects. So I can introduce myself. My name is Eleni Petridou from Cyprus. Cyprus is a small island near Greece in the Mediterranean Sea. And today is gonna talk about collaborative projects in cultural spaces in museums and galleries, and how art therapy is trying to do these transdisciplinary team projects. So a little bit myself, I have studied in the UK art therapy in our Queen Margaret University, before in Athens School of Fine Arts, and I have been also to Czech Republic for Erasmus. I am a member in European Federation of Art Therapy, EFAT, and in the Art Therapy Association of Cyprus. So today we will see a little bit the role of museums and gallery, and how this can help in the psychological support, how we use history, collections, and art in our art therapy practice, and how we try to familiarize individuals with the culture, how museums can collaborate with all these museum educator staff and other people that they are not in psychological sector, and how we can do this psychological contact with art materials. So today I'm going to show you today collaborative projects that we have done in Cyprus. That is not only for people that they can be accessible in museum. We are inviting people that they haven't been to museum before, because maybe they are poor, or they are older adults, or they have some disabilities. So we are trying to invite them and do art therapy in museums. So this project is out of the clinical setting. We are in a community space, and that's the bibliography and citations about how community art therapy is important. It's because it's quite out of the mental health clinic, out of the hospitals, out of the office, and you are going in a free space that is accessible for all the people. And in that passion, we are trying to find empowerment in the community. Community projects are every time free from the participants. And in that paper, we can try to stop stigma about mental health and start choice making and inspired by using all these collections, cultural collections. And all the people feel more happy in this friendly environment. Here I can mention some people. Kapitan, art therapist that is working in community-based programs. Ioannidis Elizabeth, she's in Athens in the Contemporary Art Museum doing art therapy programs, and many people. So the most important is how you are going to this museum and how you can start this collaboration. The most important is that you have to introduce art therapy profession to museums and galleries, because staff doesn't know what we are doing. The most important is to tell them why we can help them to do mental health projects that other educators or teachers cannot do. So I'm trying to follow my way, how I can enrich to do all this project in Cyprus. The first of all is to meet and introduce art therapy, what we are doing as profession, and then to talk if they want to invest little money to do a mental health project. That's really important, because after COVID, many museums want people back. They lost all this population, and they want population back to the museum. So we saw the last 3 years after COVID in Cyprus that people more and more going to the museums anymore, and museum, they do all the time new projects to attract people. Another important thing is to exercise and find participants. If you are doing a closed group, how you explain museum rules, how you explain museum problems, accessible problems, parkings, and how you take consent form from the participants if they are going to do an art therapy closed program for more than 3 months, to explain them that they should come every week. It's a little bit difficult, but what is important is to take time to reflect, to take evidence for your artworks and for photos from the museum, and then to evaluate this in order to open new doors for new collaborations. So here I'm going to present the first collaboration that I have done in a museum of theater, drama, and music and costumes. This is a museum in Cyprus, in Limassol area. We have been there doing a collaborative project with a foundation with people with mental disabilities, autistic spectrum, and syndrome Down. It was important to see how these people interact with the costumes, they play in the museum. We have a collaboration with a music therapist and myself, art therapist, and we try to put museum and art in the same time in the museum by using theatrical histories and movies from our culture. And this is really important because in this museum, we can see culture, things that are African, let's say, they are from other continents. So these people are learning their history and they are connecting with people and other feelings. For example, if we use how animals can feel when they are angry, they can wear costumes, they can play, how they feel by using this collection. Then they have time also to do art in the space of the museum. And so that's another thing, that you give them the space and the time to see the collection first and then to talk. What is really important is some people, they found difficulties to understand the artworks, and we have to explain them in really easy steps by doing collage, by find a shared language to talk with these people. This is another project, example 2 now. It's about older adults art therapy in a museum. So this is another one really big project that we are doing with my sub-colleague, Marina Ioannou, that she's also an art therapist, and also the Levendis Gallery is one of the most famous and private galleries in Cyprus. And this day center, that is the capital that efforts to have a small day center for older adults. So what we have done, we bring 3 organizations together. The day center of the capital, that they have the facilities and they have bus, that they take older adults from their houses and they are coming to the gallery every Friday for 3 years now. What is important, that all these older adults, they are from low socioeconomic status, so they didn't have money to enter to this gallery. And what other is important, that now we provide art therapy there for free, free transportation, free sessions, and also what's important, we do also research about how these art therapy sessions can make accessible art therapy in Cyprus for other adults. We do this community gallery that after COVID, they lost population. We do social interaction, self-expression, reducing the feeling of loneliness, reducing isolation. We have so many goals here. Well-being, share common experience, active aging, developing creativity. So this is a big project that is still going. What's important is before going to the galleries to assess the needs, to do an assessment explaining what are we going to do in the gallery and to assess the loneliness of these people before. So this is going to continue. We use DigiAging, an online tool that is also provided in many languages. And in that tool, we measure how these people feel about loneliness, if they are living alone, if they have people around you, if they want a support. We also do many other collaborations with care workers, with staff of the day center, with the staff of the education center of museum. And we do also research, so we also work with some doctors about dementia problems that we found, and we do demographics as well. So we know how many people are coming, what ages, what are the interests, if they still feel lonely after the project, and if we can do something more for their life. So this is a small shot of intervention there, how people, they have to be comfortable in the museum. If you work with many populations that they have some difficulty in movement, you should set some chairs. You have to make museums comfortable and safe for them. And then they see collections. So this is an example of Cypriot collection that we are talking about refugees. Cyprus have a big problem with Turkey because 50 years ago, a Turkish invasion happened in Cyprus. So the majority of all their adults are refugees in their own city and in their own country. So similar with Ukrainian war right now and all these refugees that are going on. So many times in therapy, we have to deal with feelings of war, with post-traumatic stress disorder, with feeling of these older adults that they have to start new life 50 years before. So how this is connected with their artworks, because many painters has work for this trauma and they replace this with artwork. So we can see how artworks can help them to connect with their self and their history and the world. So first, the instruction is that we are visiting gallery. We are giving 20 minutes for check-in, 20 minutes to see artworks, 30 minutes to do artworks, and 20 minutes of reflection. We do every time clinical notes for 3 months. This is an example how we can use an artwork. We can see an artwork from the collection. This is Neighbors, the name of this artwork. Every time we have museum educator that they guide, they tell the history of artists and the history of artwork and how this is connecting with our lives right now. So after the history of the artwork, we are considering to find here and now the problem of older adults, the sense of belonging, old habits, new habits, personal safety. Things emerge after seeing and viewing this artwork that you can see right now. And it's really important how some people, they are not telling all this problem if you ask them. They told them after they saw this artwork, so they do reveal things. After that, we are going back to the educational room. I will show you a video afterwards. How is the educational room in this space? And they do art using art materials, and they say how they connect each other, how they become friends after coming to gallery. And this is important, how we connect this participant afterwards. This is another important session that we talk about grief, about losing persons, about losing countries, about losing our, let's say, lover. And it's important because grief can be every time in your life, in every stage, and they can grieve with the absence of someone, of something. So again, we use an artwork from the Paris collection of this museum. It's not only Greek collection and Cypriot, we have also artworks from European Union. So it's important to see that they're learning for Europe as well. They are learning for things that we might doesn't know that they haven't seen before. So from this artwork, we found a memory, the desire for love, the desire of touch, cathartic ways, what you are doing to reconnect with past people and to find the meaning of life, techniques to cope the loss. That's really important to work also with the refugees or for people who lost someone. This is another artwork that a participant done. Her husband is still alive, but she's grieving because he has dementia and he's losing himself. So it's important how people inspired from artwork and they do their own artworks. So this is the way how we can see it. We can see artworks, and then we are trying to find new hobbies, new network, new places, spiritual care, how we put artworks together down to review. And in the end of the project, every time we collect all the artwork, we do a small exhibition in our own room, like a safe space. We don't give this permission for others to see. Only participants saw their artworks, and it's really important to see how many things inspire from the collection and how many things evolve. We have really nice comments that they feel connect, happy. They like to talk with museum educators. So it's everything really important how this collaboration is going to do. So now I'm telling about another project that we do with the Ministry of Education of Cyprus. We're trying to put art therapy in schools, something that is not easy in Cyprus, because Cyprus Art Therapy Association is new established and we are not really many, only 10 art therapists are in Cyprus. So we try to put some programs in museums explaining what art therapy is, and put pedagogical methods for art therapy by using clay. So this is a collaboration with an artist, an art therapist, myself, and museum education and staff. And you can see how we inspire from archaeological collection right now to talk about human body, to talk about mental health, and how our self is not only body, it's our spirit as well. We are trying to learn this to teenagers, that they give attention to the body and the Facebook and influencers, things like that. Now we can give deeper inner self by using clay. Also, we give every time feedback tools for the clients, the students, to assess the project and feel happy for that or not happy for that. Here is also important to find museums that they are accessible, that they can be important, that we can bring toilets for disabled people, for people that they don't have wheelchairs and they don't need to have staircase. We need parking to come. We have accessible training room, educational room, and at some points they are not easy to find these kind of museums. So this is another collaboration that we do, the Petridou Ministry of Culture of Cyprus. We're trying to work in state art galleries and bring art therapy and well-being programs about adults right now and relationships around. So again, we use an community art studios collaboration with art therapists, museum education and staff. We are inviting NGOs and other organizations to learn about culture and mental health. And we do some projects not only in museums, outside museums, in the gardens, in the studios, community work, that people are learning more once they are in the community, not only in hospital and clinical. They feel more comfortable to work out that. So this is examples of some projects that we do, and the funding is coming for the cultural spaces and the Petridou Ministry of Cyprus. This is some of the artworks that participants done in the museum. However, many times in state galleries, we have problems. We don't have accessible, we don't have staircase, we don't have problems. Many people doesn't have a special toilet. Some people, they don't know how to come. So we are trying to diminish the problems in cultural spaces and make museum also accessible with our support. And that's important that some museums change a lot after our collaboration. So coming to the end, it's important to see that how art therapy can be applied in art therapy project by art viewing, art making, transformation, visiting the gallery can be healing, connecting with others, with group art therapy sessions in community, sharing the gallery artwork with personal stories, the sense of belonging. However, before finishing, I want to say that there are many challenges also working in a big group with transdisciplinary groups, because some people, they don't expect that the group will end. We have programs in group dynamics, many times problems with museum facilitators. They don't respect that things can be combined and can be contained. We have to put many boundaries with staff, not to intervene, the same in museums, with them in schools. We have to explain everything in day centers about art therapy because they don't know. So it's really difficult to deal with all these organizations. And also in some people, they start to forget. They have dementia, they're coming to museum and they are not able to focus anymore. So it's really important to think who is gonna come in this project, which population is more beneficial. And the most important that I learned for our collaboration is curiosity.
Я дуже перепрошую всіх учасників конференції. У Львові почалася
Thank you so much.